Welcome back. Welcome back. We have my special guest, my sister, Dr. Nina Ford Johnson, with us today. Hello, Dr.
Nina. Hey, Nicole. Thank you.
Thank you so much
I'm so glad
for joining me today. I am ecstatic. I put myself on a pedestal when you agreed to come today. You couldn't tell me nothing for maybe 30 minutes.
Okay.
When you agreed. Yeah. Me and my children walking around like, what's wrong with you? I'm like, y'all can't tell me nothing today. So I am so honored to have you here. Yes. We're going to chit chat about some things because we need the help. We need the knowledge. We need to know what to do because a lot of us, we don't know what to do.
Sure.
We have primary care physicians in our lives, but we don't know what questions to ask. Good. Some of us don't even know what to do about what ailments we do have.
Right.
So I don't know anybody else better to come help us out there.
Oh, you're kind. Thank you so much.
So we're going to start with some of the things that I'm realizing. Let's give us what you can and what you will about diabetes. Your knowledge based on that and what we can do to kind of steer away from catching it, if that's probably the wrong word, or getting it. Sure. I don't even know if that's the proper word. That's just how oblivious I am of the disease.
Sure.
So talk to us all about diabetes just briefly.
Okay, good question. Let's start this off.
Okay.
So when I first moved to Alabama about 7 years ago, I never saw or experienced diabetes as bad as it was until I came here. Wow. I practiced in Nashville. I did training in Texas. But not until I came here and saw how diabetes affected our community. And it's not just the older people.
Right.
They're young.
Yes.
And I'm talking about from kids all the way up to folks my age, a little younger. It's affecting all of us. And it's something that we need to talk about and we need to address. Education starts in infancy.
Yes.
That's where we start talking about what's right to feed our children, our infants. We can't give them the fruits first or the baby food. We've got to go to the vegetables first. Because once they get the fruit, they want the vegetables. And that continues all the way to adulthood. So we got to start early. According to 2012, Alabama had the third highest rate of diabetes in the country.
Oh my gosh.
There are about 14 to 15% of adults in Alabama with diabetes and 17% of African Americans in Alabama adults have diabetes.
Oh my God.
This affects, so if you see about 10 people, know about 1 or 2 people of those 10 do have diabetes. And some of those are even undiagnosed, and that's scary.
Oh my God, I think that's alarming.
Very alarming.
It's very alarming. And just knowing that we can control most of it.
We can.
Just by our diet and exercise.
Oh yes.
That's I don't even have a comment about that because I'm learning as well as the audience is about this particular disease. And I know you said, of course, it starts with infancy. She is a pediatrician. Yes, she is a very awesome pediatrician.
Thank you.
What do you recommend for those who have not done what was needed back during those younger years, who are adults and who are just now being diagnosed, or who just want to get back to start doing better so they won't get diagnosed with it?
Very good.
What foods or what do you recommend, even if it's not just for certain foods, what do you recommend us do?
Thank you so much. Every prevention is key. Before we prescribe medicine and things like that, as physicians, we try to leave it in the hands of the patient.
Yes.
Because it's up to them. So first thing I need all my adults to do, including all my parents and my kids, yes, an annual exam of their physician. Okay.
That's serious.
That is serious. Thanks to what we call Obamacare, if you have private insurance, that annual exam is paid for. You don't have to, usually you don't have to pay a copay at all, but it's a given. Yes. So it's something that needs to be done. And you do it every single year. And so there are things that the physician will ask you for. They'll measure your weight, they'll check your height, they'll do your blood pressure, they may take blood work, but it's very key that you go every single year. And don't skip a year. Some things that we can do at home is, instead of taking the elevator, or like when you go to work, instead of taking the elevator, you take the stairs. Or on your lunch break, instead of sitting out in the car like sometimes I do and take a nap, walk around the building.
Walk during lunch.
Why not? It may reinvigorate you for the afternoon hours.
Yes, and I'm horrible because I work from home. So.
Okay.
But I do work out.
Okay, good.
I do work out. I work out 6 days a week. But
that's
if
awesome.
I did not, and if I had to go to a building,
yes,
I probably wouldn't work out as much.
Yes.
And I would be the one sitting in my car.
Yes, and we, especially African American women and women in general, we have to start taking ownership of our health, because a lot of times we're involved with our children, our husbands, taking care of our parents, our grandparents, and everybody else in the community, including our church members, but we leave ourselves out. No more of that. So take advantage and start taking care of your own self. So if that means you have to get up 30 minutes early to do what you have to do in terms of exercise, if you have to start planning your meals on deciding what I'm going to eat for this week or for the day, if the week is just too much, that's okay. Do that because you owe it to yourself.
Oh, we needed to hear that, especially the women, because we do. I totally agree that we tend to take care of everyone else.
That's right.
Except ourselves.
That's it.
And that's key, and that's an epiphany for me, because I definitely had to take note of what you're saying.
That's
because
right.
we do have to take care of ourselves. That is... Listen, I hope you guys are taking notes. I'm taking notes. I will go back and try to update some of this stuff so you can see it in black and white. But this is a real serious thing that we need to talk about when it comes to living. You know, we talk all the time how we doing this and how we're doing that, and we want to live. Well, if we sick, it's kind of hard to live the life that we want to live because we're all still very young. So a lot of us are in better health than the 30-year-olds or the 20-year-olds. But as we get older, we tend to still think we're in our 20s and our 30s, and we don't take care of ourselves.
That's right.
So I'm hoping you guys are taking notes and taking heed to what Doc is talking to us about today. We're going to move on to, let's talk a little bit about high blood pressure. Give us some knowledge on that.
So high blood pressure, we start screening for that in terms of pediatricians at the age of 3.
Wow.
Yes. So every child who comes in at the age of 3 should get their blood pressure checked, whether it's for a sick visit or for a well visit. And it should be done for the adults as well when they go to the doctor, because that tells you a lot about their health. The goal number has always been 120/80, but we want to shoot below that, okay? Because that lets us know, that tells us a lot too. If there's someone's a little bit elevated, then we recheck it, and we recheck it frequently. For children, we don't go by 120/80. That's a nice ballpark figure, but there's a chart that we have to look at. So I'm looking at their height, I'm looking at their weight, I'm looking at their growth percentiles, compare that to the blood pressure, and then that determines, do they have high blood pressure or not? There's a lot of children who are walking around with high blood pressure as well. Does it run in the family? Does it have to do with their weight and their obesity status? Does it have to do with their diet? So there's a lot of interplay when we look at blood pressure, and then also when we look at diabetes. Because if you're at risk for one, more than likely you're going to be at risk for exactly.
They go hand in hand. Wow. We're going to take a short break. You guys kind of take it all in. We're going to come back and we're going to talk more with Dr. Nina Ford Johnson, getting back to health. That's what we're discussing today. So you guys don't go anywhere. Stay tuned.
I think you need to call Jerome.
I'm Attorney Jerome Carter. Call me right now.
Come on, come on, come on.
And we're back. We're back with Dr. Nina Johnson today. We're going to continue on with the conversation, and we're going to talk more about diabetes before we close out. Let's talk. Give us some rundowns just on the basic of diabetes and what we need to know as far as adults or children, and how it affects our everyday lives.
Very good.
And how it affects us just from head to toe.
Oh, good. Yes. So usually some of the first symptoms that I see of a child or an adult that may have diabetes, one, is that they may be urinating more frequently than normal. So say if a child was potty trained before, or could hold their urine during the day and at night, but say now they're having more accidents. Or say if a kid comes in and all of a sudden they can't stop vomiting. There's loss of weight. They're very tired. Those are signs. So I know that there's sometimes kids have stomach viruses. A lot of them do. But occasionally, there's some children where I'll just say, you know what, let's get a urine sample just to make sure. Because with diabetes, the kidneys can't handle a lot of the sugar because of the lack of insulin production. And so we'll check a urine, and that's a quick test to let me know, not invasive, so that can be done on adults and children to let me know what their diabetes status is.
Okay.
Also, a quick blood draw of their finger. Quick finger prick will let me know too. And so going down that route, that determines what kind of diabetes, if they are diabetic or not. In children, most of the time we see type 1 diabetes where the pancreas doesn't produce insulin. Hardly produces insulin at all. Because insulin is a hormone that keeps our glucose, our sugar, in check.
Okay.
And so type 1 diabetes, they tend to be really, really sick, especially those children. Now, I'll be honest with you. The diabetes that I'm seeing now in children, there's a mixture between type 1 and type 2.
Wow.
It's to the point where now the hormone we call endocrinologists, pediatric endocrinologists are saying that with these children that we're now seeing, that we're labeling with type 1, we're not sure if they're type 1 or not. Could this be a type 1 and a type 2 type mixture? That's why we have to follow them very, very closely. Right. Diabetes can affect everything from head to toe. We're talking about strokes because diabetes, you have a lot of glucose and fat that deposits in the arteries. So you get those arteries in the neck and they get clogged. That leads to strokes. Those same blood plaques can get in the eyes and it leads to blindness. So that's another sign that some people may have diabetes, is that they lose their eyesight or blurry vision. It can affect their heart, causing high blood pressure and heart disease. It can affect their liver. As a matter of fact, there's something called non-alcoholic steatosis, a fatty liver. We're seeing these in kids nowadays, and it's the #1 reason why children get a liver transplant, because there's too much fat in their liver because of their diet.
I need you to repeat that. Because of their what, Doc?
Because of their diet, sis. But it's something that we can change.
Yes.
It's never too late.
Yes.
Never too late. Even if you're a horrible diabetic today, you can still change. Diabetes runs in my family. My grandmother died because of complications from it. She was not a big woman at all.
Right.
Very thin. But it affected her. But she made some horrible diet choices.
Yes.
She was okay with the peach cobbler and apple pie, and we kept telling her, we can't do this, Grandma.
Right.
We can't.
She did what she wanted to do.
She did what she wanted to do.
And that's what I've known.
Yes.
That people who have complications of diabetes, that's what I've seen so far with me becoming familiar with it with family members, is something that they either didn't eat or they did eat is what caused them to start having those symptoms where they are having to go to the hospital or they're having to take in more insulin or lack thereof or whatever the case may be. So I definitely wanted to hear you say that your diet has a lot to do with
yes,
it.
Lord.
Oh my goodness. So what else can you tell us? I was like, I need to go get myself checked again. I'm like, oh my goodness, I'm sitting here thinking, have I had this? Have I had this type of symptom? It's just scary. I'm one of those. I don't know what you call it, but when someone talks about something, oh girl, yes. I'm like, oh my gosh, could that be me? I'm one of those people.
That's okay. That's why I never recommend going online and checking your doctor, Googling yourself.
Yes, I can't do it. It is. Oh girl, I'm here to bed bobbed up like this. Don't touch me.
I think you're about to die tomorrow.
Yes, that is definitely me. Definitely me. So what else can you tell us about? We know now that diet affects it immediately.
It does.
We know exercise affects it.
Right.
What else can you tell us as far as symptoms? Or let's talk about overcoming it.
Oh, very
Let's
good.
talk about some
Very
things
good.
that overcomes it. How can we get to this better health when it comes to
Very
it?
good. Even if you have a label of diabetes, if you lose weight, you eat right, you exercise, you may not need medicine at all. Y'all hear that, folks? No medicine.
Do y'all hear that? Listen, I'm no doctor, so you done heard it from the doctor.
That's right.
If you have it, it's something that you could get off those meds if you take care of yourself. Don't let the meds take. And this is coming from a doctor. I'm gonna say doctor. Listen, we got to take care of ourselves.
Yes.
Nobody's going to love you more than you love you. So listening, and I'm taking notes. I'm still taking notes, and I'm going to post this again. You've heard it from Doc. Take care of yourself. Diet, exercise, those are two of the most important things. And that's with any disease. Am I right, Doc?
That's right.
Mostly, I guess, with any disease, if you're taking care of yourself, I know some things you can't control.
Correct.
But for the most part, when it comes to, I guess, I hate to use the word catching. That just sounds so ugly to me. When we receive or start having symptoms of different things, if we take care of ourselves through diet and exercise, we tend to be okay.
Yes, and that takes care of a lot of things. And it's all about taking care of ourselves. And we're not just going to stop the medicine on our own, right? All under a doctor's supervision and guidance. But we have to empower the patient. And it's hard enough to wake up every day and be black in America and in this world.
Girl.
And we have a whole bunch of other stuff against us that we have to fight.
Already.
Yes. So, but that's okay because we can do it because we're an overcoming type of people.
Yes, we are.
So, all we have to do is just follow directions, do what we're supposed to do, and everything else will fall into place. Yes. Go see your doctor. It's okay. Take the medicine that prescribed you. Right. But one thing I want to leave with all your people today, all your fans and family and friends, and mine too, is if you have questions, you write them down and you make sure the physician answers every single one of them. If they have a question about their medication, bring all your medications to the doctor visit every single time. Become empowered. Right. Know what your diagnosis is. Know what you're taking. And ask questions. Yes.
That's very important.
Very important.
Oh my goodness. I hope you guys have learned as much as I have in this short period of time. I have on speed dial. Y'all don't have access to it like I do. So she may be tired of me is why she probably came on today.
Oh, no.
I hope not. But I love her. I hope you guys have learned so much today. If you have any questions, put them in the comments. Maybe I could nudge her and get her to answer some general questions. I'm sure there are some things that she can't answer, but general questions, I'm sure she will. So drop some questions if you have any. But like she said, you have to take ownership of whatever ailments you have. That's the only way you're going to fix it. You have to just recognize it, grab hold to it, and control it. And we all can do it. So I'm rooting for everybody out there who may be down. I know depression comes with a lot of new things that you find out that you're diagnosed with. Doesn't have to be anything terminal, but it's just a change of lifestyle that I know that some of us will get a little depressed. We don't have to stay that way, y'all. She has told us it doesn't have to stay that way. Grab hold of what's going on and just change it. You have the power to change it. So if you have any questions, drop them in the comments. I thank you so much, Doc.
Oh, thank you, love.
Thank you for all you're doing for the community. Thank you.
You're awesome.
Thank you for we lift each other up.
That's it.
But we have to lift each other up. And so I'm glad you're here. I'm glad you are one of our doctors because we couldn't be in the community without you. I know I'm watching you too.
Bless.
So
thank you.
Tell the hubby I said what's that?
I will, sis.
Yes, and
thank
you guys have a great day. Thank you for tuning in to Inquisitive I Am your host, Nicole Petit. See you guys next week.